Hello, everyone. In this short podcast, I'm going to tell you about the Patient and Carer Race Equality Framework, otherwise known as the PCREF. My name is Dr. Jacqui Dyer, and I'm the National Mental Health Equalities Advisor for NHS England, where I've chaired the development of this framework since 2019. The PCREF is the first anti-racism framework for the NHS. It applies to all mental health service provision wherever they are located. It helps services to improve access, experience, and outcomes for people from racialized communities. It is also a way for patients and carers to get involved with their local NHS trust or service and hold them to account. The PCREF enables people to participate in service transformation and service innovations that better respond to their needs. What I mean by the term racialized communities is ethnic, racial, and cultural communities who, although they are the global majority, are minoritized populations in England. Equally, the term ethnically and culturally diverse refers to people with distinct cultural or ethnic identities, which can include diverse language groups and communities upholding specific cultural customs and spiritual beliefs. As communities who have been racialized, we mean that they are treated differently, often negatively, because of their race, and this can also lead to marginalization. The Patient and Carer Race Equality Framework, also known as PCREF, is relevant at all levels of mental health organizations, covers all mental health service pathways, be that children and young people services, talking therapies, perinatal services, etc., and focuses on the differential experiences of racialized communities with the aim to reduce racial disparities. It is a very targeted, systematic approach to reducing health inequalities for this cohort of people. This anti-racism framework is also relevant for local authorities, their partners, and commissioners who provide support to children and young people, adults, and older adults with mental health needs. The PCREF represents a significant shift in tackling racial inequalities and inequities. As a race equity accountability framework, it applies wherever the public purse is being spent on mental health service provision. Its emphasis on participation and transparency creates the opportunity for tangible improvements in mental health services. Let me tell you a bit about how the PCREF came about. As you can see from this slide, the PCREF has been almost 10 years in the making. It is not an overnight wonder, but started with documents that were published back in 2016 from the CRISP Commission and 2018, the Independent Review of the Mental Health Act. The PCREF has been carefully co-produced with many stakeholders over the years, in particular our patients, service users, carers, community groups, VCSE sector, and indeed our pilot PCREF sites. Why did I make this recommendation in the first place? As a carer and service user for nearly 40 years, I've been horrified by the lack of importance placed upon the voice of lived experience to inform service improvements. It is no mistake that the framework is called the Patient and Carer Race Equality Framework, as it gives voice to those communities being served. What makes the PCREF different from all the other initiatives that the NHS has provided over the years? One of the key developments announced in March, has been the inclusion of a new clause in the NHS standard contract to state that implementing the PCREF is a mandatory requirement for providers of mental health services by the end of March 2025, and then subsequently going forward. It is incorporated into the Care Quality Commission's, CQC, regulatory assessments for health and social care services. The PCREF participatory approach means that leaders, workforce, voluntary and community organisations work collaboratively with patients, carers, significant others, nominated persons, and community members to co-create the changes required and the innovations that will help improve access, experience, and outcomes. We know this approach is a game changer in building the relationships that matter, providing the evidence that matters, and we've been inspired by the perseverance, enthusiasm, and commitment expressed by stakeholders thus far. The PCREF is structured into 3 parts. Part 1, leadership and governance, which is about what senior management should be doing to change things in their organisation, as well as the range of data sources relevant to a collective intelligence to help inform decision making. Part 2, which is organisational competencies. This is about the skills and competence required by staff to ensure that these services work for everyone who needs them. And part 3, the patient and carer feedback mechanism. This is about ensuring that the patient and family's voices and community voices are heard and listened to. These podcasts are here to help you better understand each part of the PCREF. In further podcasts, we discuss how the PCREF is unfolding in action. We will unpack the PCREF's systematic approach and how it applies to local services, integrated care systems, and different service pathways. For example, talking therapies, inpatient services, and community mental health services. In essence, we will provide you with an understanding of each of these services so that you are better equipped and able to understand where you need to go when you need help and support, but also how you can influence the shape and nature of that help and support. We will also explore ways you can get involved in this agenda as we move from describing how bad things are for racialized groups to how we are going to make things better through implementing the PCREF's rigorous, transparent, and systematic approach. Today, I will focus on PCREF Part 1, Leadership and Governance. There will be separate podcasts for Parts 2 and for Part 3. Part 1, Leadership and Governance. All NHS trusts and most mental health providers are statutory organisations. Some are independent services. Either way, this means they are bound by law to fulfil their legal duties to ensure that people in society are being protected by legislation such as the Mental Health Act, the Human Rights Act, the Children's Act, the Care Act, etc. They are regulated and monitored by organisations such as the Care Quality Commission, known as CQC, and the Equality and Human Rights Commission, known as EHRC, who have both supported the development of the PCREF. For example, the CQC has developed a new assessment framework prioritising equalities, whereby trusts and mental health service providers must continue to demonstrate performance in 5 key areas: safe, effective, caring, responsive, and well-led. The PCREF will be evidenced in the areas of well-led and responsive. CQC have provided initial guidance and learning for their regulators and are in the process of developing full guidance on PCREF, which they aim to publish later this year. This will detail how they will assess how providers are implementing the PCREF. In the meantime, they will continue to encourage and support services to embed the approach through their regulatory activity. The EHRC have responsibility for monitoring human rights, challenging discrimination, and promoting equality. They will monitor how providers respond to tackling disproportionate rates of detention of ethnic minority people under the Mental Health Act 1983. The PCREF identifies 12 key legal requirements which apply to trusts and mental health providers and which affect racialized communities. The NHS Act 2006, the Human Rights Act 1998, the Equality Act 2010, the Carers Leave Act 2023, the Mental Health Act 1983, the Mental Capacity Act 2005, the Mental Health Units Use of Force Act 2018, the Health and Care Act 2022, the Care Act 2014, the Health and Social Care Act 2008, Children and Families Act 2014, and the Children Act 2004. Providers will be expected to embed the PCREF in their governance structures, which requires strong leadership at the top and throughout the organization. Organizations are expected to have nominated leads at board level, an executive lead, a non-executive lead, and a governor to drive forward and embed a local PCREF plan which addresses Part 1, Part 2, and Part 3 of the PCREF. The leadership should be replicated at all levels of the organization in order to show whole system ownership of this agenda. As well as this, the development, implementation, and review of local PCREF plans must be done in equal partnership with racialized and ethnically and culturally diverse communities. This of course, will be taken into account by the CQC as part of their assessment process to make sure providers are implementing the framework in their services. Providers will need to evidence how they are elevating the voices of community representatives within their governance structures, establishing partnerships with local authorities and voluntary sector organizations, community groups to engage on local priorities, implementing culturally appropriate care, and commitment to become an anti-racism organization. A huge part of the work at NHS England to roll out the PCREF has been the testing we have done with our pilot trusts. This began in 2022 with 4 mental health trusts: South London and Maudsley NHS Foundation Trust, Birmingham and Solihull Mental Health NHS Foundation Trust, Greater Manchester Mental Health NHS Foundation Trust, and East London NHS Foundation Trust, and has progressed to where we are now, working with 13 trusts across England to test how the framework will work across different service areas and for different racialized communities. We have also embarked on a program of work with ICS systems, that is, integrated care boards and integrated care partnerships, to explore the best ways that the PCREF can be supported at that level. One of the pilot trusts, South London and Maudsley, introduced what they call a triple leadership approach, meaning that they have nominated or ensured through this triple leadership model means that there is representation across the governance structure from people who use their services and their carers, Black-led community organisations and the workforce. The triple leadership model is reflected through all stages and processes, including designing the overall PCREF programme, overseeing the change programmes to embed the national organisational competencies, and setting up a separate evaluation group and process to monitor the progress and the impact of the PCREF over time. I should explain that South London and Moseley have focused on the Black community because they have a large Black community compared to other areas, and a review of their data indicated that Black service users and carers suffered the greatest disparity in access, outcomes and experience in their mental health services. The Trust has created a quarterly report based on the PCREF quarterly report template developed nationally in conjunction with the pilot sites, using key data and metrics from the PCREF Part 1 guidance to further identify areas for attention. Furthermore, another catalyst for change were the deaths of Sean Rigg and Olaseni Lewis whilst in the care of mental health services. When mental health trusts in other areas examine the demographic data for their local population, they may find that they need to focus on a different racialized group. That's the beauty of the PCREF. It enables trusts and providers to tailor their services to ensure they meet the needs of their own communities. Because as we've learned over the years, one size does not fit all. Here are some examples of what other mental health trusts have done for Part 1 of the PCREF. Within East London Foundation Trust, in identifying priorities for improvement in meeting the specific legislative and regulatory requirements relating to equalities to include in local PCREF plans, they ran a series of focus groups to better understand the experience of Black, Asian, and other ethnic and culturally diverse patients, carers, and communities in accessing mental health services and their recommendations for improvements. In North East London NHS Foundation Trust, in co-developing, implementing and reviewing local PCREF plans with racialised communities and their workforce, they established an independent executive advisory trust board in September 2023 to provide oversight for the implementation of the PCREF. It includes local community leaders, local authority, patient and carers, school, faith leaders, voluntary sector organisations, and the police. In terms of monitoring core measures at board level on a regular basis and publishing PCREF plans, Sheffield Health and Social Care Foundation Trust developed a dashboard that is accessible for service users to review data, ensuring greater transparency. So going forward under the PCREF, providers are to actively demonstrate how they are reducing inequalities for racialized and ethnically and culturally diverse communities. To do this, they are encouraged to review the specific recommendations of the Mental Health Act Review 2018 and the 12 key legislations I have listed before. Then they will need to demonstrate or evidence that they are fulfilling their core legislative requirements from a racialized lens. Providers and organizations will be required to explain data trends in partnership with stakeholders, and over time should be able to show they have reduce racial inequities. This information will be transparent and publicly available so that patients, carers and communities and anyone who wants to can see where improvements are being made or as not, as the case may be, and how they can be involved in the transformation journey. We also want to understand what the PCREF looks like from the level of integrated care systems, where the statutory obligation is to reduce health inequalities for a wider population geography. So that was a brief introduction to PCREF Part 1. To get more information, visit the NHS England website at www.england.nhs.uk/PCREF to download a copy of the PCREF Guidance version 1. There is also an easy read and audio version available, plus a short video of me speaking to some of the senior leadership team at South London and Maudsley Mental Health Trust about their visions for the PCREF. For an alternative access to all of these resources, we will be making them available on the Black Thrive Global website at www.blackthrive.org, as well as the websites of other partner organisations. As I said before, there will be more podcasts on PCREF Part 2 and 3 to follow, and there will also be live video podcasts taking place periodically through the year, where I will be speaking with people who are implementing the PCREF right now to share their knowledge and learning. Collectively, we are determined to be at the top of our game for those people who need quality and equitable care when they are at their most vulnerable. We all want mental health service provision which is trustworthy and delivers care with dignity and respect. This is a journey. It is a marathon and sometimes a sprint. Do join us as we are in the realm of the possible, where the appetite for positive change is palpable. Thank you.